national headquarters. My name is Jonathan Dilley, and I have the distinct pleasure of serving as Chief of Staff here at PLTW. I know some of you from my time at Faegre Baker Daniels' Washington, D.C. office, served as a consultant there for a little bit over a decade before coming back home to the Hoosier Heartland a few months ago, and I'm pleased that our paths have crossed again today, albeit very briefly. Many of you are familiar with Project Lead the Way, but for those of you who are not, we are the leading provider of rigorous, hands-on, activity-based STEM curricular programs in middle schools and high schools throughout the nation, and soon to be in elementary schools. Right now we're in 5,000 schools in all 50 states, serving 600,000 students annually. There's a good chance that your son or daughter, niece or nephew, or next door neighbor's child has taken a Project Lead the Way course or is currently enrolled in one. You know, we get to witness every day the enormous results of dedicated teachers engaging students in learning that will catalyze a lifelong interest in science, technology, engineering, and mathematics. I'm particularly proud of our high school biomedical sciences program, which engages high school students in the concepts of human medicine, genetics, microbiology, physiology, and public health. Throughout the program, students work collaboratively to investigate and design innovative solutions to the healthcare challenges of the 21st century, not unlike the issues that have brought you all here today. With that said, I recognize that you have a full agenda, and I'm going to turn it over to David Johnson. And again, it's been my absolute pleasure to welcome you to Project Lead the Way. Thanks so much. David.
We're all trying to get used to the stage up here. Good morning. I'm David Johnson. I'm the President and CEO of BioCrossroads and BioCrossroads parent, the Central Indiana Corporate Partnership. And for the first time, not only are we having an event here at Project Lead the Way, and we are very grateful to our hosts for having us here this morning. This is a great place to do this. We'll definitely be back if you ask us. Because also, not only these superb facilities, but we get to have other people join us. I'm assuming, because my vision's not real good, but I'm looking up here and I think that our other locations are all on, so that means I don't have to connect anybody, which is really, really fortunate. Mason, Ohio, and Richmond, Virginia, and Wallingford, Connecticut. We have colleagues in all of those places who are joining us today. This is really cool for us because the purpose of these framework sessions, we were talking about this a little bit before we came in this morning with our panel. The purpose of these is educational, broadly educational, and it's pretty wonderful when we can actually extend the educational reach of this beyond all of us sitting here to good colleagues and friends on the outside. I want to look into doing a little bit more of that because this is a great experiment to do. So my purpose here today is very brief. It's just to really introduce the topic, introduce Brian Sweet, who will introduce the panel. But those of you who work with me know I can never resist saying a couple words before something starts, and there's usually some sort of historical connection to a panel, and BioCrossroads definitely has a historical connection to the panel here today. And again, I want to elaborate a little bit on this because we are joined by people who probably have no idea or probably have never needed to have any idea about what BioCrossroads is. So those of you who are here know, those of you who are joining us, here's a little bit of background. BioCrossroads was formed over a decade ago as part of a strategic cluster initiative of the Central Indiana Corporate Partnership, brought together by our corporate and philanthropic and university communities here. We are completely privately organized and funded, even though we collaborate a great deal with the public sector in key opportunities. And the purpose of BioCrossroads, the same as with TechPoint or Connexus or Energy Systems Network, which are all other CICP affiliates, is to try to find the best stuff in this region of Indiana and this part of the United States for further development, for further investment, and most importantly, for the further attraction of talent to get and retain the best and the brightest people we can have here in Indiana who can help us build the next generation of Indiana's economy. This part of the state has been historically fairly prosperous. even in Indiana terms, but that is not done by accident, and certainly the future is going to be far more competitive for all of us going forward. And so these initiatives really focus on what are the best things that we can do, the most skill-intensive, knowledge-intensive, business-intensive areas that we should be focusing on. BioCrossroads was started in 2002, 2003 to focus on that in the broad topics of healthcare and life sciences. Like any good initiative, BioCrossroads started by going out and hiring a really expensive consultant who came in, right? I mean, that's how these all work. Who came in and worked with us. Actually, it's Battelle Technology Partnership Practice, which has done wonderful work here over the past decade in a number of areas, and they were seminal in helping us set up shop into what BioCrossroads could be in the life sciences and healthcare areas for further growth. And in working with them, we further identified 8 what we called target areas where we really wanted to focus in the beginning. This slide you're looking at here comes from early 2004, where we really wanted to look at what the best life sciences opportunities we would have here. And you'll see that most of them sort of make sense as life sciences areas. Cancer, biosensors, ag, because plants are life sciences too, neuroscience, proteomics, sports-centered life sciences. We do a lot of that here. And then you see evidence-based medicine. And that was a topic that we had to explain to people. What does that mean? And what's that doing on a list of biotechnology, medical device, diagnostic technologies as an area of opportunity for further growth? And the answer was, again, this is a decade ago. But even then, the possibilities and the promise of digital information for the better practice of healthcare was very apparent. No one was doing it very well across the country, but the opportunity was clear, and the need, if healthcare was ever going to become more efficient, was paramount. We had here a head start, in fact, a leap start over the rest of the country for a variety of reasons in thinking about the use of better information, initially for better healthcare delivery, ultimately for the better discovery and development and delivery of therapeutic, diagnostic, and device products, which is kind of the tie back into the pharmaceutical industry, the device industry, and the broader life sciences sector. Our head start was not only did we have an enormously sophisticated healthcare system here, an outsized share of life sciences companies, one of the largest in the United States, but we had 2 things that made us unique in the opportunity to really chase the promise of evidence-based medicine and, again, the use of digital information for better care and better discovery. And those 2 assets were, first, the Regenstrief Institute at Indiana University. And again, for those of you joining us from outside, the Regenstrief Institute was founded by, in late 1960s, early 1970s, by the guy who named Sam Regenstrief, who figured out how to match digital technology with kitchen appliances. He actually cornered the dishwasher market by being the first person to put digital controls, absolutely true, digital controls on a dishwasher. He ended up by that, this is a guy who clearly watched the walk on the moon, the NASA programs, all the rest, and said this could really work in kitchen appliances. He was right. He made an even larger fortune. And what he did with his fortune was to give it to IU and to the Regenstrief Institute, obviously named after him, and essentially said, this is paraphrasing, I don't know what digital information can do for healthcare, but it sure has done a lot for appliances. So if we can do something as simple as that in your kitchen, we really ought to be able to do something a heck of a lot more important for that in your body. So he gave it to the Regenstrief Institute. The Regenstrief Institute was formed. People tried to figure out what digital technology and frankly, the beginnings of evidence-based medicine within that setting looked like. They formed a partnership with Wishard, which is the now called Eskenazi Health, which is the public healthcare provider here whose staff are all doctors from the IU School of Medicine. So Wishard is a teaching and research facility affiliated with the IU School of Medicine, as well as a huge public hospital and trauma center here. And Wishard in the late 70s, early 80s, moving into the 90s, was practicing electronic and digital health, having electronic health records, treating patients electronically decades before anybody in the rest of the country was even thinking about doing this. When BioCrossroads came on the scene in the early 2000s, what we did was to say, that is really interesting. And if you could have electronic health records being used not only involving the Regenstrief Institute, which is a data repository able to do analysis, health outcomes, health quality research, and also move information. If you could do that with one hospital and one academic nerve center, this Indiana Network for Patient Care, which is the jewel in the middle of this, the data repository, the analytical function. What would happen if you hooked up the rest of the central Indiana healthcare market, which again, for those of you outside here, this is a big competitive place. We have 5 major healthcare systems here, deeply competitive, intensely competitive people, but all wanting to work together to pool information and use and have an exchange because they understood early on the value of that for better treatment if they could all come together. And so the Indiana Health Information Exchange was formed, a fee-for-service exchange, not a government-subsidized program, so right from the start this was something that worked. It is today, you'll hear more about this in a moment, it is today by far the nation's most successful, sustainable health information exchange and network, and that has huge promises for the future to come. But interestingly, in this, back to evidence-based medicine, beyond healthcare, we saw from the very beginning and talked in the very beginning about other things that you can do with this information once you are using it to treat patients in real time. And that includes, frankly, doing a heck of a lot more in the whole concept of really doing smarter, better, faster discovery and delivery of medicines and of treatments that work, and of things like comparative effectiveness to try to figure out what works better than something else. You can't do any of that stuff without having the evidence, without having the data that's necessary. And so we are now poised at that point to be able to say, with this network, with this Indiana Network for Patient Care, and most importantly, and I told you there were 2 pieces, the other piece of this is WellPoint is here. And WellPoint was in fact becoming WellPoint. The merger with WellPoint and Anthem was happening just as BioCrossroads was being formed. WellPoint obviously, even in 2004, was very visionary, very much ahead of its time, trying to figure out how to use electronic digital information to be a better payor and a better participant in the healthcare system. So their commitment to research and frankly to strategic acquisition and development in this area from the very beginning has been enormous. And so by having WellPoint here, by having the healthcare system here, by having Regenstrief here, and by having an outsized portion of the pharmaceutical and device companies here, we ought to be able to figure this out. And that's where we are today, and I'm especially glad today that we have people participating in this panel, colleagues, again, I'm not going to introduce because that's going to be what Brian does, but colleagues from the Cleveland Clinic with whom we have done some really good work. We have someone here from the Indiana Health Information Exchange. We'll talk a little bit more about how it fits into this picture. We have Marcus Wilson, who I've worked with from HealthCore for a long time. Marcus is HealthCore is affiliated with WellPoint. You'll hear a whole lot about how that works and what he does, and again, WellPoint's stake in this incredible race for knowledge and effective treatment. And then we have a pharmaceutical company with us here today, which is not Eli Lilly and Company, and that's a cool thing too. And so that's where we're going to start is with Brian Sweet, who I want to ask to come up here in just a moment, who's going to introduce our panel and again sort of set the stage for this discussion of real-world evidence. What happens, again, beyond healthcare delivery when you really start to have the data that can drive effective discovery and change. So Brian is the Executive Director for U.S. Payer and Real-World Evidence at AstraZeneca. He focuses on AstraZeneca's initiatives in these areas, and that includes comparative effectiveness research. And in that role, he collaborates with health plans, pharmacy benefit managers, and a variety of key business partners. He oversees the U.S. Health Economics and Outcomes Research Team, focusing on the development and implementation of real-world evidence studies. Prior to going to AstraZeneca, Brian was the Chief Pharmacy Officer at WellPoint here in Indianapolis, so he's not a stranger to us here at all, where he was responsible for overseeing clinical pharmacy services and again had a role within WellPoint that captured the opportunities for WellPoint at that time and that prepared him extraordinarily well for what he's doing with AstraZeneca today. He is the guy who will set this discussion in motion this morning. You guys are in for a treat. And so, Brian, if you'd come on up and introduce the program and the rest of the panel, we'd all appreciate it. Thank you very much. It's good to be here. And I would be remiss, I almost did it. I want to thank our sponsors, which I almost forgot to do. In addition to Project Lead the Way, we are very grateful for your sponsorship and having us here today. Want to thank Miles Printing for having us here today as well. And let's see, I've got one other one. Oh my gosh, WellPoint. Thank you, WellPoint, very much for having us here. Okay, Brian.
Thank you, David.
Thank you.
Well, good morning.